and welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, my name is Brittany and I'm a nurse practitioner, and I'm also the creator of the Brittany Holzbeck NP Review. It is a complete review course for the AANP and ANCC exams. It is also accredited through the AANP, so if you take the course, you are eligible to collect over 17 continuing education credits. The really cool thing is you don't actually need to be a nurse practitioner student or a nurse practitioner to take the course. You could also be a nursing student or a registered nurse if you need to collect CEUs, which we know we all need to do to maintain our licensure, then you can take the course too. The entire course is available on my Patreon. I'll have everything linked in the description box below, so you can go ahead and check it out. There are 4 tiers available, so make sure you read the description of each one before purchasing, and if you have any questions, just reach out to me. Otherwise, we're just going to get into the content for today, but before we do, make sure you like the video and subscribe to the channel. It is a free way to help me out, and I really do appreciate it. All right, so before we get into today's content, I did want to say, yes, I dyed my hair. I just feel like I should address it because I look like vastly different from my last video. Do you ever look in the mirror and feel like really bored, like with the way you look? I just had this like sudden urge to change something about myself, and so I literally went and got box hair dye. I think it turned out okay. It's very vibrant. Like, I think it needs a few washes to calm down. That's all I'm going to say about this, but I just wanted to address that yes, I did dye my hair. I'm a redhead now. Okay, anyway, so today we're going to be talking about some more medications that you need to know for your boards exam. So there's a theme to today. It's going to be 5 medications that you need to know that are OB-GYN related. And that's definitely when you're going to take your family nurse practitioner licensing exam, something that you need to be well-rounded in. And so we're going to go over 5 medications today that you definitely need to know in the OB-GYN field. Okay, so the first medication that you need to know about is going to be Rogam. So Rh factor is an inherited protein found on the surface of red blood cells. If a person has this protein, then they are considered to be RhD positive. And if a person does not have this protein, then they are considered to be RhD negative. Most women are RhD positive, meaning that they do in fact have this Rh factor protein. However, if the patient is RhD negative, then they need to receive Rogam at 28 weeks pregnant and within 72 hours of either delivery, miscarriage, or termination. And so it's going to be really important to know if your pregnant mom is RhD positive or RhD negative. And the reason it's so important is because this is to help prevent Rh incompatibility. And this is how I always remember who in fact does need to receive Rogam, is the saying, it's never good if a mom is negative. And that just reminds me that if mom is RhD negative, then she does need Rogam. It's never good if a mom is negative. All right, so the next medication that you definitely need to be familiar with would be the Tdap vaccine. This is not obviously only given during pregnancy, but it does have a very important implication during pregnancy. So the Tdap vaccine should be given every pregnancy between 27 and 36 weeks gestation. And this is specifically to prevent pertussis in the neonate. So pertussis is of specific concern for infants 3 months and younger, and studies have shown that more than 50% of the time when a young infant does in fact contract pertussis, it's due to a close family member, typically the mother. And that's why it's so important that every pregnancy, the mother gets the Tdap vaccine. And again, that's to help prevent pertussis in the newborn. And not only is this important for boards, but it's just a really important education point when you go into practice. If the mother is asking, why every pregnancy, because it is an uncomfortable vaccine. I personally hate getting the Tdap. My arm is always so sore, but it is so important. Studies have actually shown that receiving the Tdap vaccine in pregnancy has shown to decrease the chances of pertussis by 78% in infants younger than 2 months old. So it's just so important. All right, so the next medication that you definitely want to be familiar with is going to be the copper IUD. And IUDs are so important to be familiar with because they are the most commonly used reversible birth control method worldwide. Specifically though, I'm going to talk about the copper IUD. It's sold under the trade name Paragard, and the copper IUD is a non-hormonal IUD option. And this actually allows for the female to have continued menstrual cycles. However, if the woman is contemplating getting the copper IUD, they should be counseled that they may experience heavier, longer, even more painful periods in the first few months after having the copper IUD inserted. Contraindications to the use of the copper IUD include hypersensitivity to copper, pregnancy, deformity of the uterine cavity, active pelvic infection, and unexplained abnormal uterine bleeding. And although the risk for pregnancy with an IUD in place is extremely low, if in fact a woman does become pregnant with an IUD in place, then they need to be evaluated for an ectopic pregnancy because there is an increased risk of ectopic pregnancy with an IUD. It is noted, however, that with the copper IUD though, studies have actually shown that the likelihood of an ectopic pregnancy occurring is actually less when compared to other IUDs. And lastly, it's important to know that the copper IUD has been approved for 10 years of use. All right, so the next medication that you need to know would be folic acid. And this is so important when it comes to pregnancy, as folic acid supplementation is actually shown to decrease the risk of neural tube defects by up to 60%. So for females of reproductive potential and with a low risk for neural tube defects, it's recommended to prescribe a multivitamin containing 0.4 milligrams of folic acid once daily. It is recommended that this is begun at least 1 month prior to conception and then throughout the entirety of their pregnancy. In women that have had previous pregnancies affected by either neural tube defects, or if the mother or biological father has had a neural tube defect, then it's recommended to prescribe a multivitamin containing 4 milligrams of folic acid at least 1 month prior to conception. However, it's preferable that they actually start this 3 months prior to. The dosing can then be reduced to 0.4 milligrams of folic acid once daily after that first trimester. All right, and then the last medication that we need to go over that you need to know for your board's exam is going to be fluconazole. So the diagnosis of vulvovaginal candidiasis is made based on the presence of candida on a wet mount. So treatment is going to be indicated to relieve symptoms. However, if a patient is asymptomatic, then they actually don't need to be treated. So a single dose of fluconazole is used in non-pregnant immunocompetent patients with less than 3 episodes a year. And then for patients with frequent candida infections, severe symptoms, or if they are immunocompromised, then it's actually recommended that we give fluconazole in 2 sequential doses. And that's going to complete the 5 OBGYN medications that you need to know for your boards, and then some hot topics that you definitely just want to be familiar with in regards to those medications. I thought it'd be interesting to close this video out with a test your knowledge question and see if you were paying attention and if you learned a little something. So the question is, which is incorrect regarding the copper IUD? Is it A, that the copper IUD is a non-hormonal form of contraceptive? B, the copper IUD is approved for 10 years of use? C, the copper IUD will stop a woman from menstruating? Or D, the copper IUD is contraindicated in patients with unexplained abnormal uterine bleeding? So again, the question is, which one is incorrect? Is it A, B, C, or D? If you chose C, then you were listening and you got it correct. The copper IUD does not prevent women from menstruating. In fact, they do continue to have their menstrual cycles. And even more so, in the first few months after insertion, they could experience heavier, longer, and more painful periods. Okay, so I think that's going to be all for today's video. Hopefully you learned a little something. If you found it helpful, make sure you like the video and subscribe to the channel and stick around because there's more to come. As always, I appreciate your support. Otherwise, I wish you guys nothing but the best. Don't forget to learn something new every day, and I'll talk to you guys soon.